I'm going to talk about the bony landmarks in the shoulder. First of all, I'm going to start off with the clavicle, which we can see here. It runs horizontally along the top of the chest and articulates laterally with the acromion of the scapula, which is here. It can be palpated very easily, and it goes the whole way around. Next, we're going to move on to the sternoclavicular joint. It is to the medial end of the clavicle, and it articulates with the clavicular notch of the manubrium. We can see the sternoclavicular joint here. Next, we're going to move on to the coracoid process. This is found to the inferior of the shaft of the clavicle, and it can be very tender when palpated, so just go quite softly. Next, we're going to move on to the scapula, so if I could get you to turn around. Here we see the scapula. It is a triangular shaped bone, and it is vital in the role of the movement of the arm. It has several fossa, corners and ridges, which we can see here. And first of all, I'm going to talk about the spine of the scapula. It is a very prominent bony region, and it passes laterally and slightly superior. We can palpate it easily at the top of the scapula and runs round and angles up. Next, we're going to talk about the acromion process, so if I could get you to turn around slightly. The acromion process is the lateral aspect of the spine of scapula and is located at the top of the shoulder. We can palpate the acromion process as we will feel an indent and a ridge as we palpate. Next, if I could get you to turn around again, I'm going to talk about the borders of the scapula. First, I'm going to start with the medial border, which we can see here, and this is just the border towards the spine. We can palpate this quite easily down. Next, if we move here, we can see the lateral border, and it's not as defined as the medial border, so you might have to palpate it a wee bit harder as there's thick tissue. This can be palpated towards the axilla of the arm. Here we have the inferior angle of the scapula, and it is just at the bottom of the scapula. You can feel it quite easily and palpate it round. Here we have the superior angle of the scapula. It is at the top of the scapula, and it's not as prominent as the inferior angle, so you might have to palpate it slightly harder. Next, if I could get you to turn around, John. Here we have the bicipital groove, and it runs directly between the lesser tubercle and the greater tubercle. Here we have the lesser tubercle, and it is smaller than the greater tubercle and is the attachment site to the fourth rotator cuff muscle. Here, if we palpate it, we can feel the greater tubercle, and it is inferior to the acromion and is the attachment site of the three rotator cuff muscles. These can be quite easily palpated together, as you can feel two notches and then a ridge in between.